A breast lift is a procedure that's done in a patient with sagging breasts to lift the breast back up onto the chest and to lift the nipple onto the chest as well. These procedures are good in patients that have sagging breasts for whatever reason. Some of the reasons that are common for patients to have sagging breasts are patients that have had a pregnancy and have sagging breasts for that reason because they had engorged breasts while they were pregnant, and then when they lost the milk, the breast sagged as a result. Other patients that are good candidates are patients that have had a substantial amount of weight loss because, again, the patient, while they were heavier, were also heavier in their breast, and then when they lost the weight with their body, they also lost the weight in the breast as well, so the breast tends to sag in those patients. And then there's also some patients that, for whatever reason, are just naturally have sagging breasts, and they're good candidates as well. The amount of scar involved with a breast lift procedure depends on the amount of breast sag that the patient has. If a patient doesn't have much sag with their breast, then they're a candidate for a breast lift procedure where there's only a scar around the nipple areola complex. That's an excellent procedure in those patients because that's a very well concealed scar. If they have a little bit more sagging to their breast, then they're a candidate for a vertical lift procedure where there's a scar around the nipple areola complex and a scar down the breast as well. Patients have asymmetry prior to their breast lift. We can correct some of that asymmetry in the operating room. However, it's difficult to correct 100% of the asymmetry. So there may be some asymmetry that's left after the procedure if they have a substantial amount of asymmetry prior to the procedure.